All right, so the first question here is, if the vaccine doesn't stop transmission, why do officials think it will end the pandemic? All right, so the first question really has to do with what do we know about what these vaccines do or don't do. And the reality is we don't know very much. I know it's being marketed a lot as if we do. What we have is about 2 to 3 months worth of data, at least from the larger studies that were done, the phase 3 trials. So the one I'm a little more familiar with is the Moderna study, and so that's the one that I'm going to basically be focusing on when I'm talking about these things here. But so in the Moderna study, just to give you a kind of an idea, we had 30,000 people in the study, and they had two groups. They had 15,000 people in the vaccine group, the ones who received the vaccine, and then when they had 15,000 people in the placebo group. So what happened, and I'm going off of memory from all of this for the exact numbers, but it's very approximate here. It may be exact. I believe there were 185 people who got COVID in the placebo group, and there were only, I don't remember the number, maybe 30 some, not very many, relatively speaking, in the vaccine group. And so based on that, what they said is that the vaccine is very effective, and it was 95% effective based on their numbers. But then we have to ask ourselves, well, what do we mean by 95% effective here? So, and I think the first thing to understand before we even get to transmission is, if we're just talking about how effective the vaccine is, the big problem with the study is that they didn't actually check to see if any of the participants actually got COVID in terms of the PCR testing, the testing to make sure that they really were infected by it until they had symptoms. So that means that only 185 people were checked if we're talking about the placebo group. So the other people we don't know, and so we actually don't know how many people were exposed in the vaccine group, for example. We don't know how many of those 15,000 people were actually exposed to COVID and that the vaccine protected them. What we do know is that because there were 185 people in the placebo group, the group that didn't get the vaccine, because we know that there were 185 of those, we can guess that there were about 185 that were exposed in the actual vaccine group. So that means really it would only have been tested on about 185 people, which, when you think about it, they from the study saying, oh, there are 15,000 people in the group, they tend to make it sound like there were 15,000 people exposed and only 30 got it. But that's actually not the numbers. That's not what's going on here. And so that's the first thing about the study, is that we actually haven't seen very many people. And it's also important to understand that this is an emergency type of thing, that this hasn't actually been approved under the normal approval, the normal FDA approval, because there's inadequate safety studies that have been done, honestly, inadequate in terms of safety and effectiveness for it to be approved. And that's why the other mRNA vaccines that have been made in the past have not been approved. None of them have gone to market yet. So this was another question that we had about the other mRNA vaccines. So that's a little bit of a background on what we know and don't know on the study. It does look, if you look at just the numbers that we've seen so far, like even if we just look at, let's say it's 185 in the vaccine group, in the placebo group, and then whatever 30 some in the treatment group, it does look like the vaccine seems to be protecting against COVID, at least in that small group that we have. So I would say that's very optimistic in terms of for the short term. So what that suggests for us is that people who are in very high risk situations where they don't know if they're going to be alive in another month or two, that would be probably something, even if there's inadequate safety studies. The safety studies we only have 2 to 3 months of safety data. That doesn't tell us anything about long-term safety, and we'll talk about that in a little bit as I go through some of these questions. But I do want to say that even though I'm going to point out a lot of issues or problems so that everybody's clear on what the data is actually telling us and what it's not actually telling us, I do, I'm hopeful. I want to be optimistic, even though I'm not particularly. But there are some reasons to be optimistic about the vaccine, and it could potentially stop transmission, even though it hasn't been shown. They didn't design the studies to show that it would stop transmission, so we have no idea yet. But if it does, then that would be something that would definitely be worth considering. However, there are problems with that, as we'll get into it. So one other thing I want to point out as a general question that we asked, and this was pointed out, there was some Israeli professor, I believe, who asked this question, and I thought, oh, well, that's a very interesting question to ask. He said, well, if you look at the data, there were 30,000 people in, for example, this study. I think he was actually referring to 44,000 in the Pfizer study, but it's the same concept here. In the Moderna study, there were 30,000 people, but there was only one death out of 30,000 people, right? Now, if we look at the United States, there are 300 and something thousand people who've died so far in the United States from COVID. At least that's the official figures, out of 330 million people, right? And so we're basically looking at 1 in 1,000 deaths if we're going to represent our whole population, right? But yet, if we've only seen one death out of, well, let's say 15,000 people, because if we're going to say, let's say the vaccine group was 100% protected, which, is super unlikely, but let's just say we should still have seen 15 deaths if they picked the correct population to study. So what this is telling us, that there was only one death, even in the placebo group, tells us that they probably did not pick a population that's representative of the population that is going to be that is being right now vaccinated. So I just want everybody to understand that how the studies are set up is very important in terms of what the results are that you're getting, right? So in the studies, they excluded the people who were the sickest. They didn't allow people to come in if their conditions were unstable. So they could have had what they call comorbidities. That means you also have diabetes, you also have heart disease, you have whatever. And some of those were allowed in, but only if they were stable. That means that they're more likely to survive COVID if they're stable than they would if they were unstable. But the target population are the people most at risk. And the people most at risk are the unstable ones. So they actually have not tested it yet on the population that is the most at risk. So that's just sort of a general overview to understand, where we are in terms of this. Now, that doesn't mean it's not going to work for them, because, they try to design the studies in a way that's going to maximize their ability to get this approved, right? I mean, that's kind of what the drug companies want to do, and they also want to make sure that they're not liable if anything goes wrong, and so they've also made sure that the laws also say that they have no liability no matter what happens. So they don't have to worry as much about safety from a drug company standpoint, because they're not going to be liable, if it's not safe. So what they do is then they say, well, how are we going to find out if it's really safe or not? And the way they do that is in what are called phase 4 trials. And phase 4 trials are essentially where you release it on the population and you see what happens, okay? And so there are other, if you want an example, and we did a post on this, I believe, at some point, but an example of a phase 4 trial where things didn't go as planned, even though phase 3, and remember, this wasn't an emergency phase 3, this phase 3 actually went through normal processes, and it was shown to be safe and effective, was for a drug called Vioxx, right? So Vioxx went through phase 3 and was fine, and then once it got into phase 4, then they found out, they had like 60,000 deaths. And so then it got pulled off the market. But the point isn't that this is Vioxx or something like that. The point is that we really don't know safety, even though, after this kind of a phase 3 trial. And so I just want people to understand that when they're going to get this vaccine, it has not been demonstrated as being safe for long term. It has been demonstrated as being safe potentially for 2 to 3 months in the population that was studied, which again is not necessarily representative of the population that it's being given to. And so in my personal opinion on this, I feel that for people who are at really high risk, the vaccine, and also for short term, the vaccine may make a lot of sense. It may really make sense for people in nursing homes, for people who are at extremely high risk on the COVID units or whatever that may be, or whoever may be at very high risk of dying in the immediate future. But for people who aren't, it's something to think twice about, because what could go wrong is some of these other questions, like what are we worried about with this vaccine that could happen long term? Because all I know is, somebody gets the vaccine and then maybe they faint or maybe something happens immediately. So the concern, a lot of the concerns for long term problems are really with autoimmunity. And so how this can happen is that you have there are different methods for so there are different methods for autoimmune diseases to develop. And Wendy was writing neurological disease,
neurological problems, like Bell's palsy, which they say is not a big deal, but
sure, Bell's palsy was a more immediate. That was a response. They had 3 or 4 cases of Bell's palsy on the first day or two, whatever it was, with Pfizer's vaccine, right? And so so these are the more immediate ones, and those are definitely concerns. Bell's palsy can be permanent, where half of your face will droop down, and you can't use it; it's paralyzed, and so forth. But I want to focus on that. That is a potential risk factor. We'll see over time. In the next couple weeks, we'll really know whether that's something to really worry about or not. Also, a number of these allergic reactions; those are the immediate ones. But what's more concerning to me than the immediate reactions, because a lot of immediate reactions are going to come out in some of these larger trials. When you have 15,000 people getting the vaccine, many times you'll be able to tease out, if there's something, more immediate that's happening, even given that they used a different population probably than they should have and so forth. But the long term, again, it's autoimmune disease. And so what happens is that when you create antibodies to something, these antibodies are not just they're not specific to only that particular thing. They can what we call cross-react. They can cross-react, meaning in this particular case with the mRNA vaccine, what happens is they give you the vaccine and then it basically delivers this mRNA, what they call this messenger RNA, and the messenger RNA instructs the cells to create a particular protein. Okay, this is the spike protein, what they call. So the spike, for those of you who don't know, is basically how the virus gets into a cell. It's almost like a key. So the virus goes along with this key and it finds this lock and it can open the lock with that spike protein. So the spike protein is the key. So the idea is that what we do is we want to create a bunch of these keys, and then the immune system sees the keys and it develops an antibody to the key. So this antibody is something like, you can think of it as a kind of glove or something like that that just matches to the key and goes over it, and then it makes it so that you can't use it as a key anymore. So you can't get into the cells once you have an antibody to the spike protein. That's the brilliance of the mRNA vaccine, really, is because it's very specific and it's not causing some generalized immune response to whatever. Because in the older versions of vaccines, what they did, it's not amusing, but it's kind of interesting. We think it's very scientific and precise and all this, but essentially what happened is they throw let's say it's a virus, they throw the virus in, and then they throw in something called an adjuvant, right? You've heard bad things probably about adjuvants, and this is why. So they throw in an adjuvant, and what an adjuvant's job is to basically piss off, or to basically aggravate the immune system and get it to do something and attack something it wouldn't normally do. Now, why do you say that? Because if we put in just this viral particle, the body isn't normally going to attack it. It's just going to say, what is this? Okay, it's a dead piece of junk. Let's get rid of it. But if you throw it in with the adjuvant, it makes the body react in a way that the body wouldn't normally react. It's becoming hyperactive. And that's where you get some problems with autoimmunity. That's something, there's a whole syndrome called autoimmune syndrome induced by adjuvants. You can look this up in the scientific literature. There are many studies at this point on this, and that's where they use aluminum, for example. That's the main adjuvant that's used. So the mRNA vaccines, one of the brilliance with them is that they bypass all of this. You don't need to use an adjuvant with an mRNA vaccine. Because with this vaccine, you're actually getting the body to produce that key we were talking about. And then just the key comes out, and and it's in a natural way. It's a way that viruses typically operate. They get into the body, they cause the body's own machinery to replicate itself, and then the body recognizes that and makes an appropriate antibody. I guess I forgot to mention, with the other way of doing it, what would happen is when you would throw in the aluminum, the adjuvant, to aggravate the immune system, you're not telling the immune system you have to create this specific antibody. The immune system could create an antibody to anything in the area. So if there was some contamination in the vaccine, a little monkey kidney cell got in there, or whatever, there was some other junk floating around in the immediate area, the immune system could turn on that, because there was nothing in the vaccine that put the two together, that made the body attack this particular virus in that particular way. The mRNA vaccine is different. When it produces the little key, then the body knows, okay, I'm going to attack just this key. And so you don't have all of the collateral damage that you can get from using adjuvants in the other kind of vaccines. So that's why this type of vaccine is so promising, okay? So, and I think in the future, once this has been really tested well and established, I think mRNA vaccines are going to be amazing, and they're going to help cure cancer, and they're going to help with us take care of viruses and all that. So I'm really bullish about the technology, and I really love this kind of idea. However, there are problems with it that we need to be aware of, and we need to see what's happening, because we have not seen what's going on. And so now I'm going to present what some of the problems are with this particular process. So the main problem is that when your body creates the glove to go over the key, right? This glove actually attracts the immune system. I don't know if a glove was the best kind of analogy, but it attracts the immune system to come over and destroy the key. Okay, so this is how the antibodies basically work. They can bind, they can either neutralize it, they can prevent the key from working itself, or they can attract the immune system over to destroy the key. Okay, so those are some ways that antibodies work. And so what can happen is these antibodies can fit the key, but when your body creates it that fits this key, it may also fit some other things in the body. It may fit close enough that what happens is they cross-react. So let's say it fits this key, but it also fits some thyroid tissue, or some tissue in your heart, or some tissue in your what are called mitochondria, the things that produce energy. These are all things that are in your nervous system, So, and you can imagine that then if this glove or whatever it is that's signaling the immune system to come over and destroy whatever it's grabbing onto is also grabbing onto your heart tissue or your lung tissue or your mitochondria or whatever it is, that can create a lot of problems. And so this is what we call cross-reactivity. Your body is producing a specific antibody that not only binds to this key that came out to block the spike protein, but also is binding to your own tissue. And so if that goes on, then the body will keep destroying your own tissue, and that's a kind of autoimmune disease. So that's how that would develop. Now, is this a totally theoretical risk? This was another question. Is this a totally theoretical risk? I would say no. And the reason why is because there was a study that came out relatively recently. If you want to look it up, it was by, I believe Vojdani and Karazian, I don't know if I'm pronouncing his name right. But they did a study on what are called monoclonal antibodies to the SARS-CoV-2 spike protein. So the spike, remember, it's the key we talked about. That's the part of the virus. So what they did is they created an antibody, or they took antibodies to this spike protein, and they said, okay, well, I wonder what kind of human tissue it's also going to react with. So then they tested it against a number of different tissues, and they found that it did bind. It had pretty good binding affinity with, I think there were maybe 6 or 7 different tissues, that it was strong enough that it could cause a problem. And mitochondria was one of them. So mitochondria are the parts of your body that produce energy. And if those start getting problems, then you could end up with chronic fatigue syndrome. And for those of you, if you've never seen people with chronic fatigue, I've treated people with chronic fatigue, and it's really awful. I mean, your life is basically ended. You can't get out of bed. You can't do anything. So it's chronic fatigue can be awful. It also goes and it can cross-react with certain proteins that are located in the heart, and also what were some of the other ones that they did? The thyroid, I believe it was TPO that it cross-reacted to, so that can also cause any kind of thyroid problems. So the possibility of this is very real, and so this needs to be studied. I'm not saying that this is going to happen. I want to be very clear. I'm saying that there is actually evidence, there's scientific evidence that this is a very real possibility that it's happening. The second stream of evidence is that it actually happens with the virus, right? So as the virus attacks people and the body creates antibodies to the virus in a natural infection, these are cross-reacting with even more things than the vaccine is. So this is the argument as to people who aren't worried about the autoimmune thing. They say, well, if you get the virus, then it has more of a chance of creating autoimmune disease than the actual than the vaccine would. And this, this is also one possibility, and we don't have answers to this, but these are the arguments. So what I would respond to that is that the vaccine, and this is very interesting. So as a little background to this, when people get natural infections, what they find is that the antibodies drop off after about 3 to 4 months, 3 to 5 months, somewhere in that area. The protection is dropping off. And when that first came out, we actually did a post on this when it first came out, I remember, and somebody in our group was like, I wonder why that's happening. Why would the body take something that's potentially deadly, create antibodies to it, and then cause them to go away after 5 months when if you run into the chicken pox, you have antibodies for basically your whole life. The chicken pox is not going to kill you. It's not it's a very, as far as diseases go, it's a nothing disease, particularly in childhood. But yet you'll maintain antibodies your whole life. But with this deadly disease, you're only maintaining antibodies for a few months. And if you think about that, one of the big possibilities with that is that maybe the body recognizes that it's a risky venture. It's cross-reacting with the body's own tissue, and so it doesn't want to maintain antibodies for very long because it's a risk of autoimmune disease. And that would be one very plausible reason why the body is reducing the level of antibodies, or why it would want to reduce the level of antibodies. So enter the vaccine. Now, how do we want to design vaccines? We want to design them so the antibodies stay around for a long time, because who wants to go and get a vaccine that it's only going to be protective for 3 months or 2 months? And honestly, that's all we know right now, is it's protective potentially for 2 to 3 months. So not many people are going to, want to go and take risks with vaccines to get them every 2 or 3 months when the protection isn't going to last. So the idea is, let's make those antibodies stay around for a really long time. Let's design the vaccine so it does. It makes the vaccine much more effective. But here's the problem. Here's the catch. The catch is, if it makes the vaccine's antibodies last longer than natural infection, then it's going to make an autoimmune response last longer. So you can have a cross-reactive response, and then the body's antibodies go down, and then the cross-reactive response goes down. But if you're having a cross-reactive response and it's designed to stay and to keep going, then you have some problems. You have longer-term autoimmune disease, potentially. You have a much stronger potential for that. So these are some of the things that I think it's worth thinking about with all of this. Hey, Wen, do you want to read the questions that are coming up so that I can, because I can't read and talk at the same time. Okay, great. All right. So with that as a background, is there anything that was unclear about what I just said that anybody wants to ask about? I will look at that just to see. If not, I'll go and start answering the questions with that as a little bit of background.
I don't think there were any questions that came through here.
Okay, great. So, all right. So the first question is if the vaccine doesn't stop transmission, why do officials think it will end the pandemic? Okay, so that gets to this point that we actually don't know if the vaccine is going to stop transmission. So what happens in a lot of diseases that we get vaccinated for is that, and one of the big, most popular ones is pertussis, right? So for pertussis, or whooping cough, right, you get vaccinated for that, and what happens is it doesn't stop you from being infected. It just stops you from getting symptoms, right? And you say, well, whooping cough, the symptom is what kills you if you're going to die of whooping cough. Which, if you're over 6 months old, you're typically not going to die of whooping cough. But it's the symptom that causes the problem, and that's the same with with COVID. Being infected with SARS-CoV-2 is not necessarily just having that in your body isn't going to kill you. That's what we call the asymptomatic carriers or asymptomatic people who are infected, they're not lopping off and dying that we know of. They're just carrying the virus and spreading it around. So this is what happens if the vaccine doesn't stop transmission. Stopping transmission means that it's going to actually block the virus from replicating in your body. Now, I mean, you could get into some details. There are some indications that when you're infected asymptomatically, means your body is not mounting an appropriate immune response and the virus is getting in deeper. There can be, other problems that happen to you in the future. This was actually talked about in Chinese medicine, where we call this latent infections. But even in Western medicine, there have been some studies showing that people have more likely to get certain types of neurological diseases and this and that if you're asymptomatically infected. What did you
go on over these?
Oh, no, not yet. Okay, so that's if the vaccine doesn't stop transmission, that's why officials think it will. I don't know if they think that the vaccine itself is going to end the pandemic, honestly, because they're also talking about, you still have to, even if you get the vaccine, if everybody gets the vaccine, we still have to wear masks and we still have to socially distance. So it's not really going to change much socially. But I'll tell you what could change things socially in a big way, and I wish more people were pushing this. Besides this one guy, there's this guy, Michael Mina from, I believe he's at Harvard. He's an immunologist and a public health person, and he's basically a big proponent of rapid testing. So there are these rapid tests kits that he wants distributed all over the country. Every household have them, and you test every day, and that's going to be the quickest way to stop it. You test that day. If you test negative, then people can go and, who are testing negative that day can get together, and people who aren't don't. And that's the quickest way to separate and stop the transmission of the virus. And I think that has a lot of promise to it. So next.
Hold on. Some people are asking if this is going to be available later, and I think both Instagram and Facebook automatically roll it over so that you can watch it later.
Okay. And for those of you who don't know, that's my wife. So we're not wearing masks and everything, but we don't wear masks at home either. So that's, I don't know if they know that. Okay. So they're like, well, why isn't he wearing a mask? Okay. So the next is, does it provide long-term protection, or is it like the flu shot? Is it worth the risk? So it does not. We do not know how long-term the protection is. All we know is it provides potentially 2 to 3 months worth of protection, and that's it. The next question of that part is, or is it like the flu shot? So the flu shot, what happens is that we get a flu shot in 1 year. Well, I don't, but say you do. You get a flu shot in 1 year. And then the next year, the virus is mutated, or a different virus is coming around, and so you have to get another one and then another one. So the question is this going to mutate around the vaccine? And that's really, I think, what this question is getting at. And the answer is yes, it for sure will mutate. There's no question. It already has. In fact, recently in the past several days, there have been 2 new major mutations. There have been mutations all along, but this is in a major way. Where it's happening in the UK and also in South Africa. And in the UK, the data was that the new strain transmits up to 70% faster, and it has many changes in the virus. There are 23 unique changes to this particular virus, apparently, and many are in the spike protein. So what that means, if we say there are many changes in the spike protein, is remember, we created a glove that's going to fit this particular key. The key is the spike protein, so we just changed it to a different key. So if it's a different key, the glove isn't going to fit, and then you're going to have a problem. So then the vaccine's not going to work. So then you could say, well, can't you just change the vaccine to match this new key? And the answer is yes, you can. Then you've got to start trials all over again, and then you have to go and do that, and then we're going to be playing whack-a-mole, basically, with this virus, is what's going to happen. We're going to knock that one, and then the other one's going to pop up, and we're going to knock that one. And, Michael Mina, because I watched an interview with him, and it was actually quite good. It was really interesting because he was talking about some of the problems that we're facing. And one of the things he said, which was super interesting, was that we're giving the vaccine at a time when we have millions of people infected with this virus. And each person is going to have trillions of virions, of the viral particles, of the viruses themselves, inside of each person who's infected. And so if you take millions and multiply them by trillions, chances of you coming up with a mutation that's going to get past, and it only takes one, right? And apparently this whole thing, came from one mutation, right? So it only takes one for it to mutate around the vaccine. And so the likelihood of us getting mutations that are going to get around the vaccine is super high. And particularly because we're giving the same vaccine at this point. Essentially, the Pfizer and Moderna are pretty much the same vaccine to, the world at the same time. So I really don't think that I think the chances are super high that there's going to be a mutation around it, and that the protection isn't going to last long. And that's another reason why the watching and waiting and watching approach might be more suitable for people who are not at very high risk. Next question is, does it impact fertility? And the answer to that is we have absolutely no idea. When I looked at the monoclonal antibody study, I didn't see anything on fertility that it cross-reacted, but I don't know that they tested. I was trying to look and find that out. I just didn't have time to get more into that. So I don't have any anything. I know I did mention it in one of the posts, or one of the posts that we had on the website mentioned that. Now the reason is because it could impact fertility. That's definitely one of the possibilities. We know that the virus does itself. And if the vaccine were to impact fertility, you can imagine we give this to 300 million people in our country. Let's say it impacts fertility 10%, 20% of people become infertile, whatever it is, who are of reproductive age. Then our population gets cut way down. Then who's going to pay for Social Security? Who's going to pay for our taxes? Who's going to pay for Medicare and all this? Our society can collapse if we make a little mistake. But multiplied out to 300 million and 30 million people becomes a very big mistake. And so this is another reason why rolling it out to the entire country at once is, in my opinion, is extremely irresponsible. It's, the scientists know this. They know that they don't know what's going to happen in 4 months, in 5 months. They know that autoimmune diseases happen. Anyone who is a scientist who is telling you that can't happen is lying to you. And so they know this, but yet they're going very gung-ho with the disease that they don't need to. Because if you have a disease where you had one death in 30,000 people or let's say 15,000 people in a trial, in a controlled trial, then it shouldn't be bad enough that you have to force this vaccine on an entire population without knowing what's going to happen with it, without having at least how much of a safety study would you need? Personally, I would need 2 to 3 years to see that before I become comfortable with it, but at a minimum 1 year. There was a study done on, I believe it was the hepatitis B vaccine, that showed that autoimmunity developed up to a year after getting the hepatitis B vaccine in this case series that they did. So there's some indications in the literature that 1 year might be a good kind of ballpark. I think the average was 54 days in that particular study. But anyway, so I think that should cover that. Is it worth the risk? That depends. My own opinion, again, is if you are a high-risk individual, and you would have to decide that based on your own circumstances with your doctor or whatever, if you're at high likelihood of dying very soon from it, then I think it's well worth it. I would get it myself if that were my particular condition. If you're not in a high risk, I think it's personally, my opinion is that it's not worth it. It's worth watching and waiting, because then worst case you get it, and in statistics you would be at a very low likelihood of dying. Now, of course, they're always going to give you anecdotes. I always get this from my friends. I have friends who are ER docs and friends who are whatever, they're scientists, and particularly, I hear about these cases. A 17-year-old kid who was just in the ER, or who died, or who from COVID, or somebody who's 33, or whatever it is. So these things do happen. They're not statistics; they're anecdotes. So anecdotes are always going to be there. And it's not that we should ignore anecdotes, but if you're looking at weighing risks, I think personally that the statistics are better to look at, typically speaking. All right, so next, do we need to avoid people for a while after getting the vaccine? There's no indication that I'm aware of that you have to avoid anybody after getting the vaccine any more than you would before the vaccine, but you still need to wear a mask. You still need to social distance. You can't really change anything you're doing just because you have a vaccine. Has this new method of vaccine creation been successful in any capacity before or in any other countries? So the way that was worded, successful in any capacity. So it's never been, this type of mRNA vaccine has never been licensed. So we don't know in a grand scale. In the studies, there were concerns of autoimmune disease. There were definitely some safety concerns in the studies. They were not approved. So that should tell you something. However, they did say that they were, relatively safe. But if you go in and read the details of it, it's questionable. So the bottom line with that question is that we don't know. Next question is it odd that the day that the vaccines were announced that the CDC reduced quarantine time to 7 days? Is that odd? I mean, the only thing I can think of that this question is getting at would be that they reduced quarantine time, that would be more likely to spread the disease and then make people say, oh my gosh, it's even worse, and now we really need the vaccine even more. So if that's a sort of conspiracy, or now they're changing, instead of conspiracy, a lot of people are calling it convenience or coincidence. Sorry, not convenience. Coincidence theory. I really don't know why they lowered it to 7 days. There may be data, so I don't want to go in and I only produce coincidence theories on data, and so and it's always subject to other data that goes there. Typically, how long do vaccines need data to understand long-term effects? I think I answered that. In my own opinion, I would want, from an autoimmune standpoint, I would want 2 to 3 years. So if you look at things, there were some studies done on for example, studies on lupus, studies on rheumatoid arthritis. It was typically, I think it was 3 to 4 years from the first sign of an antibody until the diagnosis. So, and it typically took around 2 years for the first symptom to show up, but it wasn't diagnosed for a little longer. So that's the reason why. I'm mostly concerned with autoimmune disease. I've worked in the rheumatology department at Children's Hospital, so I have quite a bit of experience seeing patients with rheumatological conditions, and it's not something that anybody really wants to get. So to me, it's a very real concern. So how do you feel the vaccine was rushed? Yes, everybody. I think people are trying to justify it, saying, well, warp speed doesn't mean that we're not going through the normal safety studies and so forth. But that's actually if that's true, then why isn't the FDA giving granting full approval? Why is it only under emergency conditions? It's because they're actually skipping certain things. So I do think that it's rushed. However, look, this is potentially a bad virus. For some people, this is extremely deadly. For people in high-risk groups, it is. So I don't want to be overly, the vaccine's never good. I think it's amazing. It's amazing that they're able to get the type of results they're able to get. And I think if there were adequate safety data, I would be very bullish on this. Again, I love the technology. I love the fact that it's much more precise. It's not as random and as I think risky in theory. It's not as risky as the other vaccine technologies that we have right now. So next question is, how long do you anticipate it taking for us to reach herd immunity? I don't want to depress people. So I don't feel like we're going to hit herd immunity in any way. I don't know the answer to this. Nobody knows the answer to this. But if we're seeing these strains coming out already from the UK and from South Africa, and if they're even more infectious and they're flying around, these things are going to keep happening. So I don't really know. I don't really see an end to it. Herd immunity. Let's say we vaccinated 100% of people in the world, and let's say the vaccines were 100% effective. It still travels in animals, right? We already know this. Of course it's suspected or proven, I don't know which at this point, that it came from an animal in the first place, but we know cats can be infected with it. We know ferrets can be infected with it. We know, dogs are less. But because it also travels through animals, even if you stop the human vector, it's still going to be able to mutate and then come back and go around the vaccines and so forth. So I'm not quite sure that the way we're going about it is the best way to stop this and get us back to our normal lives. I think the testing has very real possibilities to be one of the best ways to get us back to our normal lives. That's in my opinion of what I've seen so far. Okay. Is the vaccine effective against strain variations of COVID? We have no idea yet. I hope it is. I really do. But as of right now, even if it is, it's just a matter of time before another strain, in my mind, before another strain comes to go around that. Would you personally get the mRNA vaccine? If I were high risk, I had a concern about immediately dying, and I couldn't isolate myself and so forth and so on, then I would, yes. Would you get the vaccine if you have a pre-existing autoimmune disease? If I were that high risk, I probably would. Under any other circumstance, I would not, including the last question, would I personally get the mRNA vaccine? No, not unless I saw once the safety studies were adequate, then I would consider that. If one has had Bell's palsy, is that person a bad candidate? I would certainly say not to get it if you've had Bell's palsy. Again, unless you were worried about dying in a month or two, then who cares if you have Bell's palsy again? It's Bell's palsy or being dead are your choices. So in that case, get the vaccine. Hasn't mRNA been studied for nearly a decade before SARS-CoV-2? Well, rather than getting into a discussion of that, it has been studied before, the mRNA vaccines, but they have not been licensed, and they have had a history of a number of problems, some successes, but there are definitely safety concerns. And again, they have not been licensed; they have not passed through that, and unless we have that, unless we have it given on a large scale, we have no idea what the consequences are of this technology. And also, it's not just about the technology, right? The technology is one facet of it, but the actual antigen that you're creating is a whole nother issue. You can't just switch an antigen and expect the same results, right? These are like the keys. It's like saying, well, I could use any key to get into my front door. Well, you can't. There's a specific key that's going to work for that front door. And that's the same with antigens. And this is the problem with the flu vaccine. Actually, the flu vaccine is never tested. They say it's tested, but the actual vaccine concept is tested at least. But each time it's a new antigen, so different flu vaccines have had different levels of problems. So some flu vaccines have had, I think it was narcolepsy in one of the vaccines. And, certain years you have a lot more side effects, and that's because it's not as predictable with that. Okay, is there any, the companies that produce these vaccines, have they successfully produced other vaccines? Have they been involved in any ethical issues in the past? Yes, pretty much every vaccine company that's been around has been involved in ethical issues. Look, people need to understand that vaccine companies are a business, and as a business, their actual duty is to make money for their shareholders. Their duty isn't to provide some safe and effective, thing for the population. I think we have to not be so naive about that. And unfortunately, and I hate to say this, but it's absolutely true. You go look it up. The CDC itself creates conflicts of interest. Now, I know why they do it, right? Because the CDC, the people working on the vaccines within the CDC, they're required by law to get a percentage of the profits. Right? And the reason why they do that, it's kind of like with the IRS, right? You want to attract the best and the brightest, and if you're only paying X amount of dollars, you're not going to attract the best and the brightest. And so they want to incentivize things in the CDC. And so they're not doing it to be evil, but what ends up happening is you create these conflicts of interest that cannot exist in a public health organization. You cannot have people, passing policies and laws for, or being involved in that process, being the trusted resource. Basically, you're having the fox guarding the hen house, right? You're having people who are benefiting financially from these vaccines, required by law to benefit financially. It's not that they're going out and asking for bribes, but you're having them try to decide what's the best way to go. And this is one of the points, like with Michael, Mina, not that he's against vaccines, but he's saying, look, why are we diverting all of these resources to the vaccines when we should be looking at the same time we should be diverting a ton of resources into this rapid testing. And so again, I really think that that's going to be one of the better ways. I hope I hope the country ends up following him in that particular realm. So were there any other questions that we had here. I just want to go through this one. If there are any other questions, you can throw them up. I think I answered most of it.
I
Okay.
think that's it.
All right. Well, if there are no other questions, or if you have any comments afterwards, you're welcome to, throw them up, or any, questions that come up afterwards. I'll try to answer them. You can just put them on the feed, however you can do that.